Well, in my opinion, Versed is used as a matter of convenience for the medical staff. It is not a painkiller, so
Yeah.
you have to have a painkiller with it. People are fooled into thinking it's called conscious sedation, is what they call when they give Versed and fentanyl as
And
a
just
duo.
and
It's
just
called
real
conscious
quick, I'm going to
sedation.
look. Yeah, I interrupted you, but just real quick. So, Versed is a depressant, and it's part of the what do you I got it. A benzodiazepine. So those are in the
Right.
same class as Valium and
Mhm.
Xanax and those kind of things, just so people know that
Right.
that's what we're talking about is Versed. So Versed is a tranquilizer. It lowers the anxiety levels, like you said, and it's their effects, however long the effects last. But as you said, Jeannie, for the older people, those effects are compounded. And the other thing is
Mhm.
there are specific incidences of acute and paradoxical reactions to these high
Right.
power drugs, which is what happened to me and it happened to your husband and other family members.
Right. And the thing that if they do tell you, they'll say you'll be awake during the procedure. Well, that's not really true. The what Versa does is like if you remember watching TV and you fall asleep and you're kind of aware, but you're really not aware of what's going on, and you probably won't remember what happened on the TV show. Versed works to interrupt the gamma waves in your brain. For
Right.
some people, this is a permanent state. It's like when you're in bed, you jerk awake, you feel like you're falling. That's what Versa does. It snaps your brain and saying, don't go to sleep into a deep sleep. And for my husband, his brain waves have been permanently, well, I don't
Affected.
disrupted. I
Yeah.
guess is the word because he has trouble getting into deep sleep. He will jerk awake. He never did that before. So when people are told that they're going to be awake, especially for an older person,
Hmm.
and then afterwards they can't remember anything, then it really upsets them because they think that they have some sort of memory issue, but they really don't. If they had been truthful with them and tell them, yeah, you will be awake if we speak to you or if we nudge you, but otherwise you're going to be into a dream-like sleep state. And it's really deceiving when they say you'll be awake. That's not really the case.
Hmm.
It's just I disagree with that totally.
Okay, so you know what? We're going to take a quick break, Jeannie Roller, for 2 minutes or so, and thank our sponsors. And we'll come back on that note and talk about it because I want to get into like the not the flip side of it, but another side to it is on what people maybe can do differently to kind of avoid these drugs and have different options or whatever because it is very scary. And the other point I want to bring up is I am looking for research. I have one paper with me here today that talks about how maybe dementia and maybe Alzheimer's is connected to some of this because these surgeries didn't happen up until like 50, 60 years ago, and it just suddenly seems like it's an epidemic for people to have dementia and Alzheimer's. I mean, it's so sad, and I just wonder what if and what there is a connection to it, and that's just my own personal opinion. We'll be right back. We're going to take a quick break. Stay tuned. And we're back on Making Rounds. I am Cindy Schwartz. I am filling in for Jennifer Toby, and I want to say a huge thank you to Jennifer for allowing me to have this to guest host this show today. And I want to show you a couple of pictures that the Cajun Navy, so that is the organization that Jennifer Toby is involved with, that is helping all the hurricane victims, both Hurricane Ida, which is in Louisiana, and also now Hurricane Nicholas, which did hit the Houston area of Texas. And it's just heart-wrenching to see some of the stuff. People have lost their houses, their livelihood. They have no insurance. And the Cajun Navy steps in, Jennifer Toby does too, with just the bare necessity, the basic water they need, the basic, I know they were looking for fuel oil, they were looking for diesel fuel, just anything that you can do to help these people. And I realize that everyone gets, Jennifer says it herself, everyone gets sick of listening to it, but it is reality. I mean, and if you want to live in this reality, it's just heart wrenching. And I think so many places in the country get hit with their unique disasters that, we all are in it together, and at the end of the day, and we just have to help each other out. So if you can donate to Cajun Navy, you want to make sure that it is UnitedCajunNavy.org. I want to say that again, UnitedCajunNavy.org. Anything you can do to help, I know they'll appreciate it. And they are hands-on, boots on the ground, and everything goes to the people that need to get the stuff. It's not like it's so much an administration, and no, it's not. These people are definitely boots on the ground, and they're all volunteers. So Jennifer, I hope you're doing great out there. And again, I thank you for allowing me to have Jeannie Roller on and talk about some of this medical stuff, because I know, Jennifer, you have helped me with a lot of it too. So before we went to break, Jeannie Roller, we were talking about my kind of what am I trying to say? Opinion of what does this stuff, this Versed, this powerful drug that is totally necessary for surgeries. I'm never going to say it's not. Again, I'm not a doctor. I mean, I can't even imagine how many surgeries that did take place because of these different drugs and stuff. But we're just wondering what the effect is long term. And we're also wondering what the effects are of people having a choice. I mean, can you say that you don't want Versed? Can you say you don't want fentanyl? Can you go to an outpatient clinic rather than a hospital to have a lot of these procedures? And I think that's what you and I are trying to do, is educate people and say, yes, you can do this stuff.
Well, my husband said he didn't want Versed. He didn't want fentanyl. So they isolated him and put it in his IV. So, yeah, you can say it. Mm-hmm. It's whether or not they will do what you've told them to do. And backing up where I was talking about Versed messing with your brain waves to disrupt your sleep, mm-hmm. It also does the same thing with your memory waves.
Right.
It disrupts them. Mm-hmm. That's how it works. It disrupts them. So it is a very valid point to be discussing. Is that disruption permanent for some people? Mm-hmm. I would say probably is. I know my husband suffered short-term memory loss for months afterwards, and still now to this day he has some. We take a lot of vitamins and herbs, so it has gotten better. Mm-hmm. But yes, for some people, I do believe that brings on dementia and Alzheimer's, certainly delusions. Yeah. Because in the hospitals, after these procedures, they're always doing those delusion tests. And, they may or may not show the true picture.
Well, plus it's right away. I mean, how are you going to do a 5-year study 5 minutes after the operation? I mean, that's not going to happen. Right. So the one piece of information that I did print out here, it's from the British Journal of Psychiatry. And the abstract background of it is the potential relationship between anesthesia, surgery, and onset of dementia remains elusive. So that's actually what they were looking at, and you're welcome to look it up. It's March 2014. It was published. And the results say, relative to the control group, patients who underwent anesthesia and surgery exhibited an increased risk of dementia. I mean, I'm reading this right off the paper. You can see me do that. And a reduced mean interval to dementia diagnosis. The risk of dementia increased in patients who received intravenous or intramuscular anesthesia, regional anesthesia, and general anesthesia. So that's the results, across the board. The conclusions were that the results of our nationwide population-based study suggest that patients who undergo anesthesia and surgery may be at an increased risk of dementia. So, I mean, there's that door opened. That's that door open there.
And they've also opened that door studying ICU patients, because a lot of times they use Versed on ICU patients, and they do know that there is a loss of mental function for those people afterwards. I mean, there have been study after study on that. Many of them get PTSD because of what happens. So there is I don't think we're going to see studies on it, because This drug is used for just about every procedure done here in the US. In Europe, it's not used. Like in Europe, over 75% of cardiac cath cases do not use conscious sedation, do not use Versed. In the United States, it's almost 100%. You're going to get something.
So we have like a minute
When you
left.
go,
Yeah, we've got like a minute left. So I want to wrap it up. And I want to say also that, we understand that it's like a lesser of two evils. Do you give the drug? Do you have the surgery? What's your outcome? Any drug that you're going to take, I mean, it's just like drinking soda. If you drink 800 sodas a day, there's going to be some kind of recourse, some kind of effect. I mean, we understand that, but we want to give the people the information that, you can go up front and say, can I have this surgery a different way? Can I have this surgery without drugs? What kind of drugs are going to be involved? I mean, in Jeannie Roll, in your husband's case, they disregard it. But I mean, you are, as the patient, it's valid to ask all these questions. It is absolutely valid. And, it's your life, it's your body. And again, thank you to you, Jeannie Roll. We're going to say goodbye here. And thank you again to Jennifer Toby. And you've been listening to Planet Vero, and stay tuned.